This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, everyone. This is Heiko from the Acupuncture on Air show. Each week I interview acupuncturists from around New Zealand and we talk to them about the different conditions about what acupuncture can treat. And we know that one of the conditions that many people suffer from is plantar fasciitis, and as Jill, our producer here, was saying, that's a big word, she'd never heard of it before, and I said, it's just heel pain. So, but today we're going to be talking to Lucinda Milne from Christchurch about this condition. So good morning, Lou, how are you?
I'm great, thanks, Heiko. Thanks for having me on the show.
That's good, that's great. Now first, just Lou, can you just tell us what this big word is, plantar fasciitis, what it actually is, and is it the same thing that as a heel spur?
Yeah, good question, Heiko. So plantar fasciitis is essentially inflammation of the fascia of the plantar, or the muscles and tendons at the bottom of the foot that link the ball of the foot to the heel of the foot. A heel spur is often the calcification of the bone and or of the tendon where the plantar tendon is, attaches at the heel or the calcaneus. The fasciitis can be a causative factor from a Western perspective of a heel spur.
Fantastic, yeah. Now listen, just before we talk about Chinese medicine and acupuncture and how it can help, are you able to just tell us a little bit what's the Western medical / physiotherapy approach to treating it? And in your experience, does it help a lot?
It's such an interesting thing. Is often people will start off having like a small amount of pain, and it'll build up and build up and build up over time, or they'll injure themselves doing something, like go for a big walk or, wear a pair of jandals walking up a hill, and suddenly they'll have this sudden onset extreme pain. When there's tension that's been building up in the tissues for quite some time, it can, and it really ramps up, it can completely immobilize people. Like, it's so painful they can't walk on their foot. So I'm speaking about this from an experiential clinical perspective. So, when someone turns up in clinic, often they turn up in a moon boot, or it's completely heavily strapped because it's too painful to walk on. The restriction enables the people to be able to walk around, but, they'll be walking around with a funny gait because they can't actually walk on their foot properly. Often they'll be taking non-steroidal anti-inflammatories. Sometimes they might have a steroid injection. Sometimes that doesn't touch it in terms of, resolution. Sometimes it does.
Because I find with most of my patients, particularly the mornings is the worst, and it's like they get up
after it's been immobile overnight.
That's right, yeah. And then they say like the first half hour, it's just torture. They have to get up half an hour before they normally used to get up, just so they could get their foot ready to, to walk out.
Yep.
And I know that these days every patient goes to the internet to research and to find out all about it, and of course people looking after themselves, trying to find a treatment for plantar fasciitis is no exception. But I think what you'll find out is that most sources will agree is that even without doing any treatment, some of these can just get better of their own, be it it can take 12 months, But my experience generally with the acupuncture, it rapidly accelerates that. But what about you, Lou? Are you able to put any sort of figure in your experience? Would you say twice a week for 2 months, or what have you been doing?
Yeah, roughly. It really depends on the severity and the chronicity of the condition, so how long it's been there for. So I would say, as a general outline, I'd say 1 to 3 months of treatment, a couple of times a week. And, once we're able to get some movement in muscles and the tendons underneath, like, often can give people some take-home exercises to do, which can help to move things along really quickly. Treatment-wise, anywhere from 6 to 16 really depends on how they respond.
Yeah, well, I think I'm pretty well with you there that if you can do it twice a week, for 3 months, then I think you can get it. And you can accelerate that, I think, with some, herbal foot washes, perhaps some specific stretches, as well as, some patients you just have to tell them to stop jogging or to, to do something which often is more difficult. But I do get quite a few inquiries, particularly, again, through the internet and through the radio show, because people are worried, you're going to stick a needle into the heel, and that's going to be like really painful, whatever. But you're able to tell us a bit about that, some of the treatment needling techniques, whether they go to the heel or they don't go? Yeah, well,
the needles don't go into the heel. It's really going into the muscles and tendons, and or around the muscles and tendons underneath the foot.
Yeah.
It's definitely more sensitive having treatment on the bottom of the foot, but compared to the pain you have when you've got plantar fasciitis, it's nothing.
Yeah.
I use very thin needles, so it's much less sensitive. I use electroacupuncture to help bring the pain down really quickly, and use a lot of manual therapy as well to help get the tendons and muscles mobilised and actually freeing them up.
Now, are you using moxibustion again, the application of the heating herb in these cases?
Yes.
Yep.
Yep. Great for moving the chi and blood where there's a lack of circulation in the periphery. Not on every case, but in a lot of cases, yes.
Yeah, because I find particularly the localised, the rice grain moxibustion is particularly useful. Now, but what about looking at the root causes of why they possibly got this problem, and I know Chinese medicine will say it's sort of liver and kidney deficiency.
Yeah.
Do you try to incorporate those treatments into the local stuff as well? Yes,
I do generally incorporate, and often that's the difference between how a physio and a traditional Chinese medical practitioner will treat. They'll actually look at the whole system and help support the whole system overall. Often this is an injury that brings people in, but these things do get taken into consideration on an individual basis. I notice clinically deficiency and excess patterns combined. I use body acupuncture to address the constitutional factors. People aren't usually coming in for an overhaul, so and often they just want to get their foot fixed and get that right.
And start running again and damage it again. Yeah,
but
I know.
Often speaking to them about nourishment and helping how they can help to support their system so they can keep doing what they like doing for longer, is always on the radar.
Right. Now, and what about any other sort of home treatments or self-help treatments, like foot soaks or moxibustion at home, or even taking Chinese herbs to help the constitution? Do your treatments involve any of those?
Occasionally I might give somebody some Chinese herbs. Like, really they're wanting the manual therapy. Yeah. So I'm mainly using tendon stretching as well as tuina, the Chinese massage. So I show people how to do the tendon stretching technique at home with a massage ball, and sometimes get them to use, some Epsom salt foot baths, or maybe give them a liniment, but generally get them off their foot and doing exercises that aren't aggravating as well, showing them stretching techniques for their lower legs to help increase that circulation, Any increase in circulation is going to help with the blood flow. It's going to help with stem cells getting to the area to help things repair.
Oh, that's fantastic. But again, Lou, thanks very much for coming onto the show, but we're going to have to finish here. We're just running a bit short of time. Jill's over there waving at me, saying it's time to finish. So we've got another song of mine, which was introduced to me by my daughter, is by a song from Adele, and the song is called Set Fire to the Rain. And before we put that on, just thanks very much for coming onto the show, Lou.
Thanks for having me, Heiko.
Yep, and then we'll get you on again in another couple of weeks, and I think we're going to be talking about skin diseases in the next. Isn't it?
Nice. Okay, talk to you then.
All the best. Thank you. Bye.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.